first of all, thank you everybody for having us to come today to explain Mike's story. My voice gets a little shaky. It's because I'm not used to speaking in front of a crowd yet, but that's our goal, is to educate everybody on somebody who had a traumatic brain injury. The picture up there shows the car that Mike was in the day of the accident. It's pretty devastating. It's also an emotional time for me, and I'm sorry. But I have to get through this, and it's my therapy too. So the first question, I went through some of the questions, and some of them are pretty much the same, but the first question is, how did it happen? Mike was on his way home from a summer job with his friend, and his friend crossed over 3 lanes of traffic at 55 miles an hour, and Mike got T-boned. The indentation of the car was 2 feet. He rolled 3 times, and took about 35-40 minutes for them to cut him out of the car. Mike was the most critical. Obviously, there was a woman that was killed in the other car. From that second on, our life totally changed. Mike suffered, obviously, a brain injury. He had a broken pelvis in 3 spots, punctured lung. He lost his vision in his right eye, and he also had what they call abdominal compartment syndrome. And I don't know if any of you know what that is, but his vitals, everything was filling up with fluid. And the only way they could keep him alive is to cut him open. So his intestines were out of his body for over a month, because every time they tried to close him up, he would swell up again. His oxygen level went down, his heart rate went down. We did anything we possibly could to keep him alive. Mike was on a ventilator. He's proud of his little hole here that he had, right? And it's been one thing after another. It took us 11 months to get Mike home. He has been in 4 hospitals, 2 rehabs, 1 residential for brain injury patients.
Yes.
And then we finally got him home.
Thank God.
Thank God? Right. So if we could show the pictures of Mike, and I hope they're not too disturbing, but I felt that this would be a good impact for everybody to understand what he went through, what we had to do. This is when Mike's in a coma. He was in a coma for almost 5 weeks. We were at his bedside continuously. We had done things kind of like outside the box. We never had experienced anything like this before. We constantly talked to Mike, and we ended up putting in his iPod with his own music. And Mike loved Christmas music, so we put Christmas music in there to try to wake him up, right? He starts listening to it like now. You do. Mm-hmm. So we were trying to do anything stimulating for Mike to wake up. So I'm going to start going through your questions. I know we're kind of on a limited time, and Mike will answer some of the questions as best as he can. Mike is still in the process of learning how to speak. He was so bad, Mike couldn't hold his head up. He would drool constantly. When we got him to cough or to sneeze, it was a big thing for us. We were like, oh God, he did that. I mean, just those little minor things was a major step. And then that's what Mike would do. We're blessed that Mike's cognitive is 100%. He started by shaking his head, no or yes. Then we started seeing Mike's personality coming out with eye gestures. Like that, like me, you know.
Oops. Oops.
That's how he started to emerge. But when Mike started to emerge from the coma, I'll never forget. Remember Pete, when he came out? We were downtown at a rehab, and they had put Mike by a nurse's station, and we weren't there yet. And we came out of the elevator. Mike was in this position and shaking. And he realized, what am I doing here? What's wrong with me?
Where he was at.
He couldn't, right, he saw all these other people and just didn't understand. And from from that time on, it's been one thing after another. Pneumonia. I mean, you're just constantly going, but we never gave up.
No.
Nope, that's right. So I'm going to kind of go through these questions. I'm not trying to be mean by going over them quickly, but I know we're on a limited time and I want to open it up for any questions for anybody. But it says, every time I read about TBIs and all the effects, all I can think about is how emotionally devastating it must be for spouses and family members. My question would be, how do they manage to deal with emotional pain? So Mike and I went through these questions, and I wrote down Mike's answers, and I'm going to let you try to answer that question if you can. You want me to go first? Okay. Mike's answer was to stay strong as a family no matter what. Family was the #1 thing for us.
Why?
It was, right? And some friends, some close friends that helped us.
True friends.
You do lose some friends, yes, through this process, yes. But the true friends, it sucks, he said. So if you guys didn't understand that, but that's what he said. The next question, there are a lot of people on the team in helping a person who has suffered a TBI. Who is the most helpful and why? And Mike, again, his answer was family and friends. It says because they were there all the time. Because always. Because we found through this whole process that the medical field is there and look at things as black and white. But we're there as victims, and that this was our son. They told us, Mike was still in ICU and told us to find a nursing home for Mike, and that wasn't going to happen. And we said, no way, we will do whatever we have, whatever we could to get Mike well. So we fought for every step of the way through the medical field, insurance trying to kick you out, and so forth and so on. So family plays a large role in a successful recovery. How has your family helped you in your recovery? And Mike said they never gave up. Family members don't know what to do, or friends don't know what to say, and they would constantly ask us, what can we do, what can we do? And we'd be like, we don't know, we've never been in this situation, how do we know? So after the initial shock that you go through, you start saying, all right, you know, what do we need the most? And we literally, for the first 5 days, never went home. We slept at the hospital. And then we were there 8-10 hours a day, every day, exhausted, coming home. So we said, do us a favor, release us at dinner time, and stay with Mike until he went to bed. Well, that was the best relief for us, and it was the best relief for Mike. Because he would have good times with them. They would feed him ice cream, and once he started to eat and, you know, pop and all the stuff that we wouldn't give him, and then they were like, well, I don't know why. But they were the biggest help for us, and what else can we say about that? They were just there for us no matter what. They never gave up, right? Are there any activities that you used to do before your injury that you are unable to do now, and what strategies do you use in those situations? Mike says, everything physical. Just for one day, think of anything that you do. He can't brush his teeth. He can't roll over in bed. He can't fix his pillow. He can't cover himself.
Terrible.
It's terrible. It's terrible. And Mike, you know, I brought some pictures too of what Mike was beforehand. Mike was very athletic. He was captain of the football team. He was a social butterfly. He was involved in everything. A goofball, yes. See that picture there? Of course. Of course. And that's the hard part. How are we getting through it? It's not even baby steps. It's minute steps. it's hard for us as parents daily living with it. And people will say that Mike looks great. And we go, yeah, he looks great, but you're not understanding what we do on a daily basis.
No.
It's, picture yourself having your mother or your father take you to the bathroom or shower you.
Yeah.
And Mike says he's tired of peeing like a girl. This is Mike's sense of humor that has gotten him through this. It's terrible. Yes. How many? On? Okay, you guys are speech pathologists. Future what? What is he saying? I don't know. So we said, you know what, we're going to not take the time right now. Okay? On? Okay, can we stop? Yeah, forget it. Okay, that's what we do. We said, thank God we learned to play charades when we were, playing as family games, because sometimes we do charades, like sounds like or whatever. You have to have a good sense of humor too. Trust me on that. Mike wants me to make sure that everybody knows that he could still make people laugh, which is a very big plus. When we first brought Mike home, it was terrifying, not knowing how to transfer him and how to change him and how to dress him. So Mike had this body that he adored. I hate to say this, but he did. But he's full of scars. And besides everything else, Mike had developed a almost stage 4 bed sore, which was pretty bad. And he wants to show his scar. See, this is Mike. This is Mike, all right? This is his scar, all right? But Mike's belly button's in the right place. It used to be over here on the side, because when he had this abdominal compartment syndrome and they couldn't close him up, they had to graft skin from his thigh to cover him up. So they couldn't pull his skin together. His belly button was over to the side. So it'll be this coming January that it'll be a year that he underwent a 5 to 6 hour stomach surgery to reconstruction his stomach.
Sorry.
The story? Oh, okay. Oh, all right. I will. I'll tell him that story. He wants to tell you about the funny story. Michael's sense of humor, he was on 15 medications just at lunchtime. We've gotten him on 0. Mm-hmm. Yay! So, of course, and I'm not trying to bash the medical profession, but they're not God, and they sometimes pretend to be. And I kept telling him, you can't take Mike off this med, he has to be slowly weaned off. And they said, well, he can't have anything to swallow, we can't give it to him in this. So Mike started going through withdrawals. So they put him on something else, which made him even wackier. So when they came, then you'll find, I mean, you're a future therapist in speech, but they talked to Michael like he couldn't hear, and they would talk very loud and very slow, like he was stupid. So the doctor came in and said, Mike, it's Dr. So-and-so. And Mike's looking at him, so Mike's sense of humor is coming out, and he goes, what's your dad's name? And Mike says, Homer. Well, I start laughing because at our house we call my husband Homer Simpson. And the doctor's thinking Mike is really flipped, and now he's ready to change his medication, but it was just Mike's sense of humor who was trying to get us through that day. Right? Yes. Okay. All right. So let's go on to the next one. Do you feel you gained something out of your traumatic brain injury? And I'm speaking of what Mike is saying, because we all have our own opinions, and he said, of course, because he's learned tons. He learned that family is number one, that life is precious, and who your real friends are. To Mike, that's been a very big issue. because he can't socialize. He just turned 21 in April. We tried to make the best of it for Mike and had a big party, and you know, Mike can hold a beer in his hand, no problems, but if you notice, Mike's hands are shut. We can't, his hands do not open. We've done one unsuccessful hand surgery, but we seem to be able to get a beer bottle very easily inside that hand. Yes. So that's another thing that you have to look at too, is the social aspect of it. We're not only Mike's parents, but we're his doctors, his therapists, his friend, his buddy, his girlfriend. We're everything to him, and that's a struggle. But through it all, Mike has had a positive attitude. He's been an inspiration to so many people, not only family and friends, but people he didn't know, nurses, student nurses that would Facebook Mike and just say how he has changed their life just by meeting him and his attitude towards everything. Because he could be very depressed, and we did have a neurologist tell us that Mike needs to go on antidepressants, and I kept insisting Mike's not depressed, and he said, oh come on, he's 20 years old and he can't walk and talk. And I'm like, I don't think you're getting the picture of it. Mike is happy to be alive. He had a second chance in life. So that was a big issue.
Yes.
So we didn't, we nixed the antidepressants, right? Yes, we did. Okay. What were some of the things that your friends and family did throughout the process to make things just a little easier for you? Which I did explain. They helped us out, brought food over. They offered, can we go grocery shopping? Can we clean your house? But see, for me, that was my therapy, to try to get my life back, to do that myself. So for them coming and staying with Mike, that was a big help for us. What would you most like others to know about TBI? And what would you like professionals such as speech pathologists to know? And Mike's answer is that they're still human beings and should be treated that way. Not to treat them like they're stupid, like 2-year-olds. Mike could not stand it. I know one of the questions is is Mike still in speech therapy? No. You kind of learn, you understand it's your job, but you also have to look at the flip side that this is my son. And 45 minutes isn't enough. So we went through it, and it was pretty much basically what I've done raising children.
Pause.
Pointless.
Yes.
For him, it was pointless. But when you get wrapped up into the insurance business and places, it's very hard, and you'll find it very frustrating when you're with a patient and you want to continue to work with them, but you have people and your boss is saying, no, you got to discharge them. No, you have to discharge them. And we've had some good therapists, but we've also had some very bad therapists. And we actually had one therapist who told us that we'd go in every day. It was the same thing. She'd go through words with Mike, same words that we were practicing at home. We never talked to Mike any differently. We talked to him like we talk to him now. Just like raising a child, you're going to correct them. If the word isn't said or pronounced correctly, you're going to do that, which we did at home. And I think we were looking for something magical to happen, and it wasn't happening. And we had one speech pathologist say to us, well, I'm going to discharge you because you don't need anybody with a master's degree to sit here and listen to your son. Well, there was smoke coming out of my ears, and said, fine, then that's what I'll do. So I found a place in Downers Grove where I had two speech pathologists. One was for voice, and one was for volume, voice, and one was for articulation. One was a professional opera singer who helped Mike with volume. You have to understand and you have to realize that every patient you deal with is going to be different. Learn about that patient. We would call them rent-a-therapists that would come on the weekends as fill-ins, and they would come and want to press on Mike's stomach to get more oxygen for him. so that he can get the volume out. Your hands?
He's talking about the third cassette burn.
Oh, yeah. Okay, we'll get to that point. But
Don't hold back, Mike.
they couldn't press on Mike's stomach because Mike had this huge abdominal problem. Read the record, read what, so we had to be an advocate and be there constantly. So we do it on our own. We did words at home. Mike gets mad at me to relax, and I'm sure you know all the different technical parts of it. Mike has a lot of tone and spasticity, and in the beginning when Mike would start to speak, he knew what he wanted to say, but he'd be like, and then he'd try. So in the beginning for us, what we would do is tell us, what does it begin with? What letter does it begin with? So he would tell us the letter, and then we'd go, okay, the next one, and we would, charades, yes. And then it would turn into be charades.
And singing was good too.
Yeah, my cousin brought up a good point. The singing for Mike was phenomenal. Mike, let's see, that had been Christmas time, the first year, but the accident happened in July of '09, so this was like in November. We put on Christmas music, and all of a sudden Mike would start singing Christmas songs, but he couldn't talk. And we're like, so we'd have people say, oh yes, well that's part of the brain that can do it. But he's getting volume, he's speaking. Then it came to Cub season, which Mike's an avid Cub fan. We would sing the winning song after the game.
Go Cubs, go.
And he would sing it loud and clear. So we knew that Mike eventually would talk,
Yes.
and he can't,
Yes.
right?
Yes.
Yes.
It's true.
Mike has always been a fast talker, and for him to slow down, it's hell. It's hell. Because to him, he says, I feel stupid. You don't feel stupid. It's the start. You don't run a marathon right away. It takes practice and training. And Mike can't understand it, but he's starting to, right?
Yes.
Yes. Okay. Let's go on to the next one. What was the earliest memory that you have of your post-traumatic experience? How much time had passed? Mike only remembers bits and pieces, and that started about maybe 4 or 5 months after the accident because there was so much going on. He was emerging. Every step, every hour was something different, and then you would get a setback on health or something, right? Yes. Okay. Is it harder to deal with reactions of family members and close friends now or complete strangers? Mike says everybody, because Mike in the beginning felt people were looking at him and pitying him, and he didn't like that. It was hard for us to take Mike out publicly also because I have to feed Michael. He can't feed himself. So, we're thinking, oh my gosh, people are going to be thinking he's 20 years old or 21 years old. How does that look?
Yes.
But you learn to get past that, right, Mike?
Yes.
Yes. If you want to put up the other pictures of Mike through the transition, Mike lost 50 pounds. He's back to his football weight. But I want to show you, the bottom picture is we just brought Mike home. He's a lot thinner. This is being home 2 months after Mom's cooking. He's put on a lot more weight.
Yeah.
You learn, Mike was on a ventilator for a long time. He had to learn how to breathe. Swallow tests, I'm sure you all know about swallow tests now. Okay. Mike failed the first one. They were shocked that he did as well as he did, but they didn't feel it was enough to take him off the G-tube. After that, we kept pushing for it, and finally they did another swallow test. But now you go through this other phase of him choking. Starting off with nectar-thick things, and Mike would start choking. He always had a lot of saliva in his mouth. One time he did choke, and we're freaking out, and what do we do? And thank God there was a CNA there. So I'm finally getting to the point, okay, here's a hamburger, here's this, that he's able to handle it. But that was another transition that we had to go through. What was the hardest adjustment to your life that you had to make as a result of the accident? Is there a person or thought process that has influenced you the most throughout your recovery? And Mike's answer was not being with friends and socializing. It's the hardest thing for him at his age. And then he said that God is the one who helped him the most, and that he's felt more faithful because of it, and he knows that he saved him. Explain your rehabilitation journey. What were the highs and lows, and did you get treated with the utmost respect and care the whole time? And I'm going to answer that. No. No. People with brain injuries are all different, and you're going to learn that over and over again. Every book I have, every magazine they gave me, every brain injury patient is different, so they have to be treated differently. Mike's severity of his brain, every part of his brain was affected. A lot of shearing, he had blood, he had contusions, he had everything going on for him. They got to the point where they stabilized Mike, but then they didn't believe Mike was going to surpass that and get any further. And they were ready to kind of wash their hands and go on. So it was up to us as a family to have to push and to have to ask and to have to do research on things. Is there one thing that you wish you would have done differently during the process of recovery? Absolutely. I wouldn't have been as nice. It was a very hard thing as us, in shock. You're going through so many emotions, every emotion imaginable, fear, hatred, how do I do this? I'll never be able to handle it. I mean, it's a constant battle. I think I would have been a little bit more persistent with some of the doctors than I had been. You learn from that, and all I can say is that if there's anybody that you know that ever, doesn't have to be to this extent, but goes into a hospital for a long period, you have to be their advocate. Mike couldn't talk. We would have a meeting with the staff at one of the places, and Mike always wanted to be in the meetings. So they said, we think, he's a little needy. And Mike is saying, no, and I said, well, in what way do you say he's being needy? They says, well, he's always asking us to clean his glasses or to turn the TV channel. And I'm like, are you kidding me? He can't talk, he can't move his hands, he can't, this is your job. But what happens is now everything is so understaffed that it's so much on a CNA or a nurse to take care of when they have 20 other patients to take care of. So that's just an insight on that. To the family, what was it like adjusting? Was it hard for other people to understand what was actually happening? As said in The Mango Princess, it was hard for people to understand that Alan would be different now because he appeared to look, quote, look the same from the outside. Like I said before, you go through every single emotional possible. Yes, it's very hard. Michael is the same person, but he is not the same person, if that makes any sense. We've always had to have a positive attitude in front of Mike to keep his morale up, but on the other side of the door, we'd be crying our eyes out. Every day we cry, but we're not going to give up because he didn't give up, and he has inspired us to stay strong. When we've had bad times and I'm brushing Mike's teeth and it just hits you, and you just say, oh my God, he's 21 and I'm brushing his teeth, this can't be right. And I'll be crying, and Mike will look at me and he said, cheer up, Buttercup, I could be dead. That was his attitude. And I'm like, yeah, you're right. So the pictures you saw of Mike in the coma, I put him on my refrigerator, and that's my reminder of where Mike was then and where he's at now and where he can go in the future. So, let's see. I think what I would want to know the most is what the biggest positive change for them since their TBI. Do they have a different outlook on life now or a different attitude towards life? Has their daily routine changed in a more positive way? I guess I would like to hear if the survivor had found any good from this unfortunate situation. And Mike wrote down to treasure life and that don't take life for granted. Right? Look at, see, that's what he's doing. He's
The
gonna
camera.
pretend. Oh.
That's what he's doing. He's making faces.
Okay. Okay, this, for the patient and the family, how are you taking the TBI injury and turning it into something positive? There's several things. Number one is talking to a class like this. For us, we want to start educating people in one way or another, whether it's therapists, whether it's doctors, whether it's nurses, whether it's driving schools, to stop and realize your life can be gone like that. And the mind, or the brain rather, is the most precious thing in your body. And we don't realize that.
True.
But it controls your heart, it controls your breathing. Yes, it controls your mind and, you know, your memory and all that, but it's all the little things that it controls that we take for granted on a daily basis. And I guess the biggest thing is that we have a foundation set up in Mike's name. It's the Michael DeStefano Foundation.org. And it's for, our mission is to advocate for other family members. Family and friends had started it for us. They saw the trouble that we had gone through. So it's small, but it is getting bigger. We've donated to several families who financially can't do it. Unfortunately, I had to quit my job after 32 years and be Mike's caretaker, which was fine because after 11 months of having somebody else take care of Mike, he's my son, I had to do it. We also donated a $6,000 piece of equipment to a residency that they had budget cuts, and they felt that this would be good for Mike in therapy. And we said, well, why don't you get it? And they said, no, we have budget cuts. And we're like, well, how much is it? And they said, it's about $6,000. So the foundation donated it. And they said, so it's just for Mike? And we're like, well, no, anybody can use it. Well, people don't work that way sometimes. So we're there to help other people, whatever way it is. And you know, I know we're kind of getting short on time, but Mike wanted me to make sure he will Facebook friend anybody, so if you ever want to talk to him. And I'm more than willing to give my email address, that if you ever have any questions or feelings or whatever, I'm more than happy to answer it for you, right?
Yes.
Okay. What are some things that you thought about in regards to the way you lived your life prior to the accident in comparison to how you live your life now? Any regrets? Any regrets? What advice would you give to any person who has never suffered any significant life alterations? Mike said he didn't really take good care of himself, did you?
No.
He said he took things for granted. His advice is to live life like it's your last day. You never know what's in the plan for you, right?
Yeah.
Okay. Does your brain ever get back to, quote, normal? Or are you changed forever? And what advice would you give to SLPS who are just starting their career? I wrote that the brain will heal in time, never 100%. But you are definitely a changed person, as well as your family. We're all different too. Not just, I have an older son who's 24, who, you know, has been there, but it's killing him. And he handles it in a different way. He jokes around with Mike, but then will go on to his other life. But he's doing it because that's how he's coping with it. He graduated from college, which we didn't celebrate. We went to the ceremony because Mike was still in the hospital. So we missed a lot of milestones. Our first holidays together were awful. Mike wasn't home, so family members would bring a turkey and they would bring this, and even though Mike couldn't eat, we did the best we can. You have to think outside the box, because if you don't, they're never going to heal right. And as a lesson to therapists, I think textbooks are great, but until you're actually with that individual, kind of go outside the box. Think of something different. What can I do? Put yourself in their position or their family's position. If that was me, or if that was my mother, or if that was my cousin, what would I do to make it the best? Yeah, I know you have to kind of have this hard shell so that it doesn't get to you when you see people who are struggling. But you also have to remember, like Mike said, they're human beings. Treat them that way. Don't be looking at the clock, or don't get, all right, we got to get the next one, because that's how you felt. After a while, you felt like you were just this assembly line, but to the individual and to the family, it's not that way. Do you or your family feel that anything positive has actually come from this situation? And Mike said yes, not to sweat the small stuff and to be grateful. Did you ever think, why me? I know that if I or someone I love sustained a TBI, it would be very easy for me to sink into anger and self-pity. How are you able to maintain a positive outlook? Yes, all the time you're saying, why me? Why us? But then on the other flip side, you say, why shouldn't it be us? Who are we? We're nobody special. This could have happened to anybody. Mike says, I was a good guy and I got along with everyone and dreaming of my future, but he figured I survived to do a mission in life. And he is, by being here today. This is the start of his mission. Mike has been saying he's, kind of all over the board on what he wants to do and through this whole process. And, he said he wanted to be an attorney to help disabled people. And, he wants to coach and he wants to be a motivational speaker. And I think one day he'll figure to work that all together to help people. He's just not going to let it go. Yeah, we can volunteer and do that kind of stuff, but that's not what we want to do. We want to change things. And hopefully the foundation gets bigger. Mike will be better soon, that I'm young enough that I still have the energy to keep going with that. Yes? We're okay.
Maybe we can see if the students have any specific questions
Sure.
that come out of
So-
as you've been talking.
Yes.
So you guys, if there are questions that have come up for you as you've been hearing their story, if there are places where you had a follow-up question or something to think about last time, if we could maybe...
Do you want to conclude with something real quick, and then you can take questions? Just your final thoughts on where you're at and how far you've come.
Well, I think I could spend weeks talking to everybody because there's so much that I'm leaving out and giving you bits and pieces of things. When Mike got to a certain point, I brought the computer, and Mike loved Facebook. Facebook was his life. Mike, being where he was teaching me how to use Facebook. And I'm like, okay. And then once Mike was able to, we got him home, we would put a pencil in his hand. And that's how Mike writes. That's the way of him communicating. Mike started, we enrolled him in online class. Maybe it was too early, maybe not. But we figured, how are we going to know unless we try? But it's tough. He misses college, he misses that life. But I said, Mike, you know what? Let's try it. I don't care what grade you get. You're using your mind. You're trying. We're trying to get back you into a routine and independency that you had before. But again, we take it for granted. Mike can't turn a page for a book. He can't outline. He can't shift. He can't do all of that. So I'm not a computer person. We had to get an online book in order for him to take this class. We took a class instead of a regular gen eds, which he needed to finish, but we took an introduction to physical education. Because Mike's goal, one day he wants to be a coach. And we figured, it's fun, let him try, let's do it. it's a struggle. He says it's hard. He goes, I can't comprehend. All right, is it you can't comprehend, or is it because you're not used to it? Is it what? So the only thing we can do is to try it, and that's where Mike is at.
Yeah.
Advice that I can give to any of you, what do you want to always say, Mike? Be true,
Yeah.
be true,
True.
and be compassionate, and you'll be successful.
Absolutely.
So
True.
I know, like I said, I told you I could speak for hours, and I'm sorry if I rambled
Oh,
on.
no, this is
But
great.
if anybody would like to ask any questions now, or I